the kind of free-floating fear that was associated with the COVID period is very quickly and easily transmitted into the discussion on climate change. So, you know, you turn on the news just now, obviously pictures of what's going on in Greece. This idea of the climate apocalypse has become very, very prevalent, when in actual fact, if you look at researchers and people who've done interesting work on this, actually, in terms of how we contain some of the problems of climate change, society has been incredibly successful in these things, and you wouldn't actually know it if you turned on the television. Secondly, as Matthew mentioned in his introduction, there's been a consolidation of these new kind of psychological behavioral initiatives around things like nudge, which have become very much a way of policymakers saying, well, we can kind of prompt people into acting as we want them to act, which I think is a real problem because it kind of denudes us of our agency to choose things. Thirdly, I think there's been vast swathes of public funding that have come out of the COVID period, which have been drifted into these new urban experiments, seemingly without any public accountability for the kind of productive value of these things. And finally, there's been a political shift, I think, which is very much represented by the way that health initiatives especially just get waved through without any real reference to the kind of democratic processes and usual democratic accountability that we're used to. So a combination of all things, I think, has left us open to these impositions, I think, from government and local authorities and city authorities to impose these new urban types of experiments on them.